Hello everyone, welcome to Auricular Medicine brought to you by Lamb AccuWellness Foundation Inc. Topic for this episode, cautions and contraindications. Pregnancy. Auricular acupuncture on a pregnant woman is absolutely forbidden. Because of the strong manner in which the ear moves the qi and blood, unwanted miscarriage could ensue from the use of ear acupuncture. The ear can be used to promote health of the woman who wishes to become pregnant and to help her recover after delivery, but it is very risky to use during gestation period. Skin problems. Avoid applying ear modalities to rashes, moles, scars, and skin reconstructed through plastic surgery, irritated ear skin, frostbitten skin, ear abrasions, or other skin breakouts in the ear. Treating unhealed skin on the ear can lead to further irritation, pain, infection. Wait until the ear heals before treating with auricular modalities. Do not needle into unidentifiable lumps or lesions. Refer patient to a dermatologist if you are suspicious of any observed anomaly. Special considerations: weak patients, cancer and diabetic patients, immunocompromised patients, children, patients with bleeding disorders and tumors. Use ear acupuncture with caution on patients who have poor wound healing capacity, immunocompromised patients prone to infection, cancer patients, diabetics, those who have HIV positive status fall into this category. Use ear acupuncture prudently on hemophiliacs, diabetic patients, elderly, those using aspirin, blood thinners, or steroids, others who tend to bleed easily, those with impaired neurological functioning, or patients on pain medications who may not detect pain or qi arrival. Patients with high blood pressure may bleed more easily than others. You can still use ear bleeding techniques on these patients. Bleeding is preferred modality for hypertension, characterized by excess heat and yang rising. Be prepared for possible bleeding. Wear gloves and have extra cotton balls nearby for possible use. Do not use ear acupuncture on young children who might remove ear seeds or pellets and put them into their mouth or nose. Except for life-threatening circumstances, do not use ear acupuncture on children under age 7, so as not to disturb body's developmental processes. Ear massage administered by a professional or by a parent instructed in how to perform such massage is a good alternative to pellets and seeds. Children love ear massage. Use auricular therapy with caution on weakened patients, elderly patients, or patients with decreased functional mental ability. Patients with severe psychological problems may not respond properly to signs of qi arrival or be able to follow instructions, even if instructions are written down. Written directions are always a good idea for properly informing the patient of instructions and advice. Use caution with ear modalities applied close to external auditory meatus so that they do not fall into the ear canal. Due to possibility of metastasis, do not use ear acupuncture on cancer patients. However, the ear is excellent modality for treating cancer patients after the tumor has been removed and during chemotherapy and or radiation treatment to assist in promoting well-being, strengthening organ function, rebuilding immunity, reducing pain. One chief indication for auriculoacupuncture is remediation of pain. If underlying etiology of that pain is not addressed with Oriental or Western therapeutics, pain relief may only be temporary and even dangerous. Noted auricular acupuncturist Paul Noget, MD, warns not to use for neuroleptics if there is vertebral blockage, as in disc herniation, for paralysis if patient has permanent scar condition. Helmut Kropich cautions not to use ear acupuncture for the following conditions: pain that necessitates surgery, demyelinating diseases, treatment of thalamus and inner genitals during pregnancy, all congenital disorders in which the spinal cord is mainly affected. Side effects of auricular acupuncture. Occasionally, following ear acupuncture treatment, ear may develop adverse skin reaction. Every precaution must be taken to avert any skin inflammation as a result of ear treatment. Thorough asepsis of the ear by clean needle technique must be maintained to prevent infection to the delicate auricle. All treatment materials positioned in the ear must be sterile. Remember that the ear is richly supplied with lymphatic vessels, thus making it particularly susceptible to infection. Infection of the ear, known as auricular perichondritis, has been the subject of many studies. O. Davis states, acupuncture must be considered a form of penetrating trauma that may induce a perichondritis or chondritis in the auricle. In one such study, Johansen and Nilsson wrote, repeated culture showed growth of Pseudomonas aeruginosa. Despite intensive antibiotic treatment and extensive surgical toilet, the patient developed a severely deformed outer ear. Of particular danger is penetration of the perichondrium by needles, tacks, and intradermals. Chronic presence of foreign body further impairs host's ability to eradicate infection. Permanent cosmetic changes to the ear may ensue. Repeated manipulation of implanted needles can cause further irritation and subperichondrial inoculation. This can happen to all patients, especially those who have diabetes, are immunosuppressed, or have a chronic debilitating disease. Retention of ear treatment modality for too long or under improper conditions may be precipitating factors in ear infection. The metal the modality is composed of is also correlated with skin reactions. Rosted notes, skin reactions in the form of eczema may develop in patients sensitive to nickel, chromium, or silver. Stainless steel has been known to produce free nickel in certain situations. F. Legault et al. Claim small particles of silver from a needle may accidentally be deposited in the ear, leading to localized cutaneous argyria presenting as a blue-black macule in the skin. Contraindications. A patient who is overtired physically or mentally. Treatment at this time can further weaken the patient, and qi is already in a deficient state. Lightheadedness or fainting can result. A patient who is under the influence of mind-altering drugs, including alcohol. Treatment should be postponed. A patient who has overeaten, he may be uncomfortable or unresponsive during treatment. Conversely, if the patient is very hungry, considered a weakened state, acupuncture also should be postponed. Relaxation, bordering on drowsiness, and sedation are possible side effects of all acupuncture, including auricular acupuncture. To avoid mishaps that might occur in this state, have the patient wait seated in the waiting room, not reclining, for 15 to 30 minutes before leaving your office. Do this after the first visit for all patients. If this effect does not occur after the first visit, you can allow the patient to monitor himself. If it does occur as a typical response, you might want to monitor the patient response as part of their treatment protocol. Potential signs of acupuncture-induced illness in auricular acupuncture are the same as with body acupuncture. They include dizziness, palpitations, cold sweats, nausea, chest tightness, fidgeting, weak pulse, fainting, and even unconsciousness. Positioning of patients. Ear acupuncture can be administered in a sitting or a reclining position. If ear is to be needled or bled, have the patient lie down, as the manipulation of qi and blood can make the patient feel weak or faint. If more gentle modalities, pellets or seeds, are part of take-home treatment, therapy may be applied while the patient is sitting or reclining. Position depends upon what is comfortable to the patient or where the practitioner is in the treatment when the therapy is applied. That is, at the beginning or end of treatment. Thank you very much for your attention. See you on our next videos.